Much of what we do in medicine, yes, it's science. It's a lot of art. It's the art of the practice of medicine. We engage in the use of intuition as physicians, and especially as DOs, because we're used to hands-on, to feeling things, to palpating. And so we utilize our intuition. And a case of intuition, I'm going to ask, if I may, I'm going to ask Dr. Schwartz, I'm just going to have you say stop at any time. Stop. Very good. I'm going to have you look, please, at the first word at the top of that page. I cannot see it. Can you see it okay?
Yes.
And I'll just have you committed to memory. Very good. So you have a word committed to memory. And now I'm going to ask, if I may, I will hand the book itself. Dr. Smith, may I hand you this book? And I'm going to ask you, please, in a moment, I will ask you to just go to any page you want in the book. And if you look at the page, you may change the page. However, I'm going to ask you not to change your mind because I want you to keep the mind you have. I'm going to ask, if you will, when you get to a page with which you're comfortable, I'm going to ask you, please, to scan down that page silently for a word. And for today's purposes, I'm going to ask you, please, to silently select the biggest word, the longest word, the most letters, the most syllables, because that will make this the most impressive. Now, if you find yourself conflicted, please remember I'm a psychiatrist, we talk about inner conflicts. If you find yourself conflicted between two words, you may silently select two words if you must. And then I'm going to ask, if you will, please, I will have you return the book to me, and please remember your word or words, because that also helps with this presentation. We have two words at this point in time committed to memory. When patients present to our practices, they present to us as if from a shuffled deck of cards, randomly entered into our daily schedules. A deck of cards, almost as mixed up as I am, and I will mix them again, shuffling the cards. And then I am going to, if I may, I'm going to ask you please just to say stop at any time. Very good. Without looking, we'll remove the card at which you stopped me, and I'll have you hold it there at the table. The deck of cards, shuffled. One card removed at random. We'll put a set of rubber bands around the deck. I am going to ask in a moment for several of us. When I hand you the deck, I'll have you place it just there in your palm, and then I'm going to ask you to crack the deck open, look at a card, remember it, and drop the deck back down. And once you've done that, I'm going to ask you, please, to stand up. May I hand you the deck of cards? May I ask you, please, to take it, crack it open, look at a card, please remember that card, and then I'll receive the deck back, and I'm going to ask you, please, to stand up. Thank you. May I ask you to take the deck, crack it open, look at a card, remember it. I will take the deck back, and then I will ask you to arise also. I didn't want you all to think you were left out being over on this side of the room. May I please hand you the deck? I'm going to ask you please to crack it open, look at a card. Please remember, then I'll have you rise up. Before time and in these days, thank you. And then may I hand you the deck and do the same. Crack it open, look at a card. Please remember it, and then I'll have you stand up and I'll take the deck back. Perfect. So we have words, cards selected. And the key is, we as physicians, nurse practitioners, physician's assistants, utilize our science, and then we rely on the art, the intuition of medicine. 4 cards were selected at random. I'm in from a shuffled deck. I'm going to ask each of you, if you will, please, to turn your back to me and face toward the wall back there so I cannot see your faces, so that you cannot send me subtle signals as to what card you selected. Please concentrate on the card you selected, picture it in your mind's eye, and then as I gently palpate the energy coming from each of you, I see a 3 of clubs. Don't do anything yet. A 5 of diamonds. Please stay where you are. An 8 of spades and a Queen of hearts. Please turn back around. If I mentioned your card, please resume your seat. Thank you. 2 words selected at random. Dr. Smith, please do not, did you select 1 or 2 words? 1. Please do not tell us your word. However, please share out loud with all our colleagues the first letter of your word. R. The letter R. The letter R does not tell us a lot. It's not supposed to. When patients present to our practice, the first time we see them, we get a piece of information. It goes into the medical chart, the electronic medical record. We type it in, an R. The second time they come to us, we get a little more information. We may get another letter, an E, and then maybe a C, and then maybe another E. And in fact, the unconscious mind goes to a word that has meaning. Because you see, Dr. Smith is now spelling a word in his mind that reminds us the most important person in all our practices is the individual, the man or woman who sits at the front desk and greets our patients, giving them the first impression of our practice. The word you are silently spelling, if I am correct, please let us know, is the word receptionist. Is that correct? Thank you very much. And thank you. And the one last word that Dr. Schwartz selected reminds us that my time is over now in having the opportunity to present to you all, because now I am supposed to be OFF, off. Is that correct? Thank you all very, very much.